Please welcome the Executive Vice President and Chief Marketing Officer of Change Healthcare, Tom McEnery.
Thank you. You guys don't look like the Aveda crowd out there. I was going to wear the black shirt, and I went for the blue. So if you need to go where to get your chakra checked, you can go down there. Hello, everybody. Welcome to the afternoon. At Change Healthcare, we work with payers and providers in a lot of ways. But at the end of the day, we're helping them make this pivot towards value-based care. And it has to do with technology, it has to do with collaboration, it has to do with a lot of history, but it also has to do with a real understanding of what the future can be. So as one of the largest independent healthcare IT companies in the United States, we're thrilled to be part of this inaugural event. As a resident of Minneapolis, I am thrilled that I don't have to get on a plane to go to an event like this. So to all the organizers, thank you very much. And I might pick up some Aveda samples to bring home. It's my pleasure to introduce our next speaker, Dr. Jijo James. He is the Chief Medical Officer for Johnson & Johnson Medical Devices. In this role, he's responsible for overseeing patient monitoring and safety surveillance practices. No small job, for sure. He currently serves on the board of directors of the Medical Device Innovation Consortium to advance medical device regulatory science and bring innovative, safe, and effective life-changing devices to those who need them most. Prior to joining Pfizer, he was a consultant providing solutions to a variety of healthcare and life sciences companies. We were just doing what everybody does that has that background, seeing who we know across the healthcare industry over the past 20 years, and it was really enjoyable. He began his medical career working as a primary care physician in both urban and rural communities. So without further ado, please welcome Dr. Jijo James.
Thank you, Tom. Thank you so much for that kind introduction, Tom, and thank you all for the opportunity to join you here. Minnesota is the hotbed of medical technology innovation, so I really can't think of a better place to give this talk. My topic is improving patient outcomes through surgical innovation. But while it might sound unrelated, I want to tell you about my experience the last time I bought a car. I don't know about you, but I can walk you through human anatomy a lot better than I can a car engine. I know my way around an operating theater with greater facility than I know my way around a mechanic shop. But that doesn't mean that I go to a car dealership and surrender to my ignorance. The last thing I would ever think of telling a car salesman is, well, I don't know much about cars. You're the expert. Tell me what I should do. I know it because I recently bought a car. And believe me, I did a lot of research. I read consumer report websites, I read reviews, ratings, reliability scores. I even went to the auto show to figure out what cars I should shortlist and consider. Now, like most of you, I'm into gadgets. It's a pathology of our profession. And while I'm always impressed by cool factors, I never lose sight of practicality and reliability. I care about bells and whistles, but far more do I care about service and safety. That is what I value the most. I want the car to go when I hit the pedal, and I want it to stop when I hit the brakes. That's really not too much to ask for, right? So I didn't necessarily need to be a car expert to know and care about what I was buying. Maybe let's do an experiment out here. How about you? Maybe by show of hands, how many of you know the make and model of the car that you drive? Of course you do. We all do. We have a lot invested in it, our time, our money, and our lives. But let me ask you this. Of those of you who've had an experience with an implant, let's say a knee or hip replacement, how many of you have had that similar experience as buying a car? Was there a lot of research and information that you got up front? Did you compare models? Did you read reviews? Did you look for safety reports, recalls? By the same show of hands, how many of you know the brand or model or even had a choice in the device you or a loved one has implanted? The truth is, in general, patients are not particularly informed about the surgeries that they undergo. Unlike buying a car, they gather minimal information up front, other than maybe identifying who they consider to be a good surgeon. They have limited knowledge about the procedure and are often unclear about caring for themselves afterwards. This lack of knowledge is a first in a series of safety and effectiveness challenges that we must address. And here is the key. Addressing these issues requires innovation. But there's something else that also requires innovation. Going back to the example of the car. When we're buying a car, we often look at the interior, the upholstery, the connectivity to wireless devices, the number of cup holders, maybe the size of the sunroof. The list goes on and on. However, what probably matters most is a braking system that senses danger and stops the car automatically, a backup camera, blind spot detection, and an automatic traction control system. So what really matters is technology that improves the overall safety and experience of the driver. The same is true of innovation in surgery. It has to focus not just on the procedure, but on the safety and experience of the patient. Now, when we speak about innovation in surgery, we are usually thinking about inventing the latest and greatest medical device. And while this kind of innovation will continue to be essential, what I'm talking about is something more. I'm talking about innovating processes, not just products. I'm talking about innovating ideas, not just inventions. I'm talking about innovating the patient experience, not just the surgical procedure. In short, I'm talking about innovating innovation itself. And for that to work, we must do several things. We must empower the patient. We must transform the patient experience from merely their time under anesthesia to their time with the device, before they get the device, while they're getting the device, and for the duration of time that they're using the device. And from beginning to end, we need a laser-sharp focus on safety. We must balance our admirable emphasis on speed to market with an equal, if not greater, emphasis on patient safety. This is not an either-or. It's an also-and. One approach to do this is probably through structure. For example, 5 years ago at Johnson & Johnson, we established the Office of the Chief Medical Officer to get all together a group of, or a team of safety colleagues who are functionally independent from commercial and development portfolio interests. But there's far more we can do as an industry in the area of safety. Consider this. Through the International Air Transport Association, the airline industry collects and shares data on their near misses in a safe space, free of judgment or blame, so other pilots can learn from these events. They are transparent and open, and their safety record is better as a result. Consider how powerful it would be if healthcare companies and providers could learn from each other. If we could leverage the data we have captured and embrace a shared culture of safety and commitment to safety. This learning healthcare system would create a feedback mechanism where all invested stakeholders, including the patient, could learn and share from their unique experiences. We need innovative ideas focused on patient safety in addition to innovative ideas around surgical procedures. Putting the patient at the center, as opposed to technology, will accelerate the development of more impactful solutions with better outcomes. Investment in pure R&D is vital, but technology ultimately drives better experiences when it has the end user in mind. Our end user is the patient. Automakers optimize innovation for the end user experience, and so do manufacturers of household appliances. Imagine how much more we could accomplish if our innovation was motivated by the infinite intricacies of the human body. We need to innovate pre-op, intra-op, and post-op. So let's begin with pre-op. Before surgery, the imperative is to match the right patient with the right procedure and the right surgeon at the right time. We need creative thinking that raises awareness and empowers consumers to engage in conversations with their surgeons. Patients need to be partners in their care from beginning to end. Surgeons are the experts, but patients are all in. Yet in the field of surgery, there is a lack of awareness that is routine for consumers. For the most part, conversations around quality, safety, and effectiveness of devices still are not happening. Asking patients to follow up appropriately if they don't know what has been placed in their bodies is like asking any of us to schedule a car service without knowing the make or model. The need to educate and support patients demands that we innovate innovation. And there is much more we can do pre-op. It starts by having conversations that make patient-informed partners in their own care and continues by treating them as individuals. Take, for example, 3D printing of orthopedic implants that have great potential to improve surgical outcomes through personalized pre-surgical planning and molding a device to the exact contours of an individual. Pre-op apps and wearable devices are preparing patients for surgery and giving surgeons precise, patient-specific health information before procedures and then guiding them through rehabilitation. Moving next to intra-op. While that's a lot of investing and researching before the big day, the patient ultimately surrenders his or her body to the skilled hands of the surgeon or nurse as they enter the surgical suite. During surgery or intra-op, we need to innovate with one simple fact in mind. Every time we perform a procedure, there is an opportunity to make a patient's experience that much better. After all, the goal of surgery or surgical innovation is to improve a patient's life by getting him or her back to normal as soon as possible. But there is a fine line between remaining stagnant and moving so quickly that the rate of errors increases. In today's ORs, surgeons now have a host of new processes and products to amplify their already honed skills. Marrying skill and technology is a recipe for success. Let me illustrate. Recently at J&J, we worked with Ariadne Labs, a partnership between the Harvard School of Public Health and Brigham and Women's Hospital, to pilot a surgical checklist project. Together, we devised standardized and multidisciplinary training for surgeons and nurses using certain devices for the first time. The training focuses on the use of a device briefing tool, including a safety checklist, and aims to improve patient safety by fostering teamwork and communication in the OR. But the idea isn't just to create a checklist, it's to drive a culture. The point is to roll out products that are surrounded and supported by an infrastructure of safety. The tool we developed with Ariadne Labs asks 4 basic questions, not rocket science, but perhaps life-saving. First, the surgeon asks the nursing team if they're aware that a new device is being used in the OR. Second, have they read the instructions for use? Third, do they have any questions? And finally, is the device ready for use? From there, the operating team moves to a surgical safety checklist before starting the case. But there is so much more at stake than simply those questions as individual inquiries. Through our partnership, our focus is to increase communication between surgeons and others in the operating team. We know that improving communications reduces risk. We know it helps members of the operating team anticipate needs. Fostering this type of communication has collaboration that parallels to cars. Delivering the latest innovation in the automotive industry requires seamless collaboration, communication, and coordination between engineers, designers, and the manufacturing flow to ensure that the intended innovation can be executed. Improving the communications process is innovating innovation. The surgical procedure manual developed by the J&J Surgical Process Institute uses digital checklists to implement best-in-practice surgical standards. In addition to driving greater efficiency in the OR, its goal is to improve outcomes by helping surgeons pause during a procedure to look at what they need to do next. Once a surgeon and their team have thoroughly reviewed the surgical plan, including how best to use the device, it's time to begin, which brings us to skill, accuracy, and consistency. Take, for example, the case of orthopedic surgery, rooted in science, but definitely also an art form. It's a space where achieving consistency is extremely challenging, where even a small deviation in the angle and depth of a cut has the potential to make a huge difference. In other words, it's an area ripe for standardization that achieves precision, safety, and better outcomes. Enter robotics. Robotics holds immense promise for improving precision and minimizing variability, therefore replicating the best outcomes and reducing the complications and additional admissions and surgeries that result from a poor procedure. Moreover, robotics has the potential to amplify the surgeon's skills by making surgery faster, more precise, and through remote surgery, possible to perform over a long distance in high-need areas. I don't know about you, but these new approaches to personalized medicine are very exciting for me. But a word of caution. The goal of using such technology is not simply to get patients through the procedure faster. It's about creating a digital ecosystem where technologies that enhance performance, increase education, and improve monitoring all help guide patients through full recovery. This simply won't be a product of deep learning. We're going to have to learn from technology so we can revolutionize the whole surgical experience. Finally, post-op. Now imagine everything I've described seamlessly integrated. A patient fresh out of surgery walking or working immediately on their rehabilitation. We've already talked about apps and wearable technology that will guide patients through rehab. But what about surgeons? A great deal of potential learning is lost if their experience stops at the OR door. Just suppose if we could crowdsource learning and leverage data in this area. What if the surgeon could record their procedure and in a patient-protected manner upload that procedure to the cloud and get crowdsourced expert feedback that enables them to do better the next time? You don't have to imagine it, because a group from the University of Washington already did through a company called CSATS, which stands for Crowdsourced Assessment of Technical Skills. CSATS is now a part of J&J, and we're leveraging a cloud-based platform to provide surgeons with feedback after their procedures. Through this system, surgeons upload videos of their procedures for qualitative and quantitative analysis by their peers online. Their skills are benchmarked and tracked over a period of time using validated tools. Ultimately, the process is designed to help a surgeon perform better, which has positive implications for the patient as well. The leveraging and sharing of knowledge is innovating innovation. All this is about innovation, but surgical innovation is not primarily about discoveries in devices. It ultimately is about a patient. And allow me to introduce you to one of them. Reagan was a young girl with a severe spinal deformity leading to thoracic insufficiency syndrome that threatened to crush her to death. The standard of care was to correct the deformity by implanting and removing devices as the child grew so as to increase the thoracic space. Multiple surgeries with an awful impact on the child. Dr. Robert Campbell, a renowned pediatric orthopedic surgeon in the Children's Hospital in Philadelphia, decided to innovate. He created a vertical rib expansion tool called Vector, and he straightened the girl's spine as she grew. Through our orthopedics business, J&J subsequently partnered with Dr. Campbell to get this device a humanitarian device exemption from the FDA in 2004. It worked. Here is Reagan standing tall and proud on her wedding day. She met her husband while out dancing, something she obviously would not have been able to do had it not been for this amazing product. This is why we innovate, not for technology's sake, but for patients like her. I am as entranced by technology as anyone in the business. I love new devices. I cherish fresh discoveries. I want to be at the forefront of unmet need. But what we really need is to innovate innovation, to seek not just the new, but the effective. Not just the different, but the safe. We need to engage the patient in his or her own care from beginning to end, pre-op, intra-op, and post-op. We need to create a culture of safety and enhanced communication within medical teams. We need new processes, not just new products. This isn't a case against innovation. It's a call for the most exciting type of innovation of all, the innovation of innovation itself. Imagine, if we care about safety and reliability when we buy a car, we should care more when we have surgery. If we educate ourselves before going to the car dealership, we should educate ourselves even more before we go to the doctor. Our lives depend on it. And if we can make automotive technology with the end user, the driver, in mind, we must make surgical technology with the end user, the patient, at the center of all that we do. If we can do all this, and I'm convinced we both can and must, then maybe, just maybe, we'll start giving as much attention to our medical devices as what we drive. Thank you.